and Tony live in a village near Maidstone in Kent. Claire's pregnant with her first baby, and for Tony, it'll be his third.
So it's due 13th November. Yes, can't wait.
Claire's having an antenatal appointment with her independent midwife, Virginia Howes. Claire's now 39 weeks pregnant.
Okay, definite back over here.
She does flip over though. She did it this morning.
Can't remember, where was she last week?
She's always there when you... But in this morning she was over there.
Yeah,
She's
you
like,
feel it. I can definitely feel the back here. You're getting lots of kicks over here.
Yeah.
At the moment, yeah.
At first, Claire and Tony had planned to have a hospital birth, but after some research and having met Virginia, they opted for a home birth instead.
When we first met Virginia, we still had it in our heads that we were still going to go into hospital because that was the norm. But then when you sat speaking to her and she sort of said, yeah, but why? And the first thing is like, well, what if something goes wrong? But then her answer is, but why should it go wrong?
Everything's absolutely fine.
People don't know about home births, and if you can have it, you know, why not? That's the problem it's everybody's sort of got into the stigma of hospital. You know, you have a baby, you've got to go in hospital. Women have been giving birth for thousands of years in fields and back gardens and at home anyway.
At this late stage of pregnancy, the baby's head is deeply engaged in the pelvis, which is not uncommon in a first pregnancy. Claire's experienced some leaking recently, which doesn't seem to be from her bladder.
You know, like I said about leaking, I don't get leaking when I sneeze or anything like that. Just all of a sudden, sometimes you will get a little bit.
Yeah, some women get confused and think their waters have gone at the end of pregnancy, but you do get increased lubrication at the end of pregnancy.
Right.
So you are damp.
Yeah.
That's different to when your waters go, because when your waters go, it's a lot more.
Claire and Tony appreciate the personal service an independent midwife such as Virginia can provide. Claire remembers feeling anxious in the early stages of pregnancy before they gained Virginia's help.
Early on, sort of had a little bit of a bleed, and I rang the NHS, or rang the number that they give you, and she was just really sort of, well, I don't really know what it is, and well, it might be something serious, it might not, but well, you're having your scan done tomorrow, so I'm sure they'll check it out then. And you're just thinking, I don't really need that. I need someone to explain what it might or might not be and be calm about it. Because that was the other thing. I'm a bit of a panic and a bit of a worrier, so that was my sort of fear all the way through, you know, being pregnant. When Virginia came along and I said about the bleed, because then it happened again, she explained why it might be happening. And she said, probably now you know that there's someone on the end of the line to explain things properly, you won't worry. And I haven't. I haven't worried about anything.
No, that's right.
For the whole 9 months, really.
Claire and Tony also see having home comforts during labour will help in maintaining a calm atmosphere compared to the clinical surroundings of the local hospital.
You know, where can you be more at ease in your own house anyway? Less chance of infection, less chance of everything.